Good afternoon, everyone. My name is Dr. Melissa McCrae from Vitality Natural Wellness and Med Spa. I wanted to just go over a couple of really neat things that I've been coming across repeatedly in our practice here at the office. The first one is about nutrient deficiencies, and these are typically what we see from often situations where people are taking a pharmaceutical drug. So it's interesting because when someone is on several classic drugs that are prescribed, we know that they will absolutely deprive you of certain nutrients. So it's interesting how they go hand in hand. The problem is those issues aren't typically addressed. So we're given a prescription to take that we know is going to deplete us of some vitamins, but we're not told we need to correct that. In turn, those deficiencies will lead to side effects. So 30% of the time, we know that the side effects associated with a prescribed medication are actually from the nutrient deficiencies that the actual drug causes. So I just wanted to go over a couple of the common ones and what we can do about those. One of the most important ones that we see is glucophage. Glucophage is also called metformin. It's the first line of therapy for diabetes. This prescription medication is known to cause deficiencies in your B vitamins, specifically B12 and also CoQ10. Unfortunately, those two deficiencies are imperative for normal neurologic function and muscular function. So we know in diabetes we have issues with neuropathy, but unfortunately the medicine we're giving you is probably leading to that tendency to actually have that. So metformin patients, make sure you're getting your B12 levels checked and make sure you're checking your levels of CoQ10. Another very common one is our statin medications. I think everybody's familiar with their Lipitor and Crestor, Mevacor. There's a whole category of those drugs, and they are absolutely known to cause issues with CoQ10. Just like metformin, CoQ10 is imperative for muscular function, but it's also important for brain function. So those categories, we really need to replace those if you're going to be on those medications. And one that people don't commonly think about is just your pain medications, whether it's over-the-counter pain medications or medications that are actually more of what we call scheduled or the narcotics. Those things specifically drive down your iron, your folic acid, and your vitamin C and selenium. In addition to that is glutathione. So everything that your body needs to heal and repair itself, we deprive you of by giving the medications that actually help with the pain. So what can you do with the information? Well, there's three things that I think are really important. The first one is most physicians don't get hardly any nutritional education in medical school. So educate yourself on what you're taking. But the next thing is when you go into your doctor's office, ask them about the nutrient deficiencies that might be result of the prescriptions that you're currently on. One of the next things you can do, and this is imperative to know what you're dealing with, call now to get some micronutrient testing. This test is a blood test. It's very simple, and we check over 35 levels of different vitamins, nutrients, amino acids, and trace minerals. We know exactly what we're working with, so instead of a shotgun approach to say, I'm just going to take this or this, we know exactly what you're deficient in, and we can correct it. And the third thing to do is the correction phase. Whether you want to be aggressive, we can do an IV therapy specifically targeting your deficiencies that has 100% absorption and the correction is immediate, or you want a more conservative path, we can definitely help you. So feel free to give us a call at Vitality Natural Wellness and Med Spa, and we'll help your body get back on track.